Okay, this lesson is for my first, second, and fourth hour. This is the coronavirus worksheet that I would like you to complete. I'm going to read it to you. You guys are going to answer the questions on the back. This is just to give you a little more information. All right? It's kind of a scary thing right now, but I think the more informed you are, the less scared you're going to be. This is basically called coronavirus facts. And I'm just writing this down. All right. It was declared as a pandemic by the World Health Organization, or WHO it's called. Coronavirus disease, or COVID-19, discovered in 2019, is a new strain of a disease caused by the coronavirus. Coronaviruses are a large family of viruses that cause diseases in mammals and birds and cause respiratory tract infections in humans. Respiratory tract infections in humans can range from mild, such as the common cold, to severe infections, such as severe acute respiratory, or SARS, and Middle East respiratory syndrome, which is MERS. Coronavirus are zoonotic, which means that they are transmittable between animals and people. Coronaviruses were first discovered in the late 1960s. Coronaviruses vary significantly in risk factors. Prior to COVID-19, two of the most publicized human coronaviruses were the MERS-CoV and SARS-CoV. Well, CoV stands for coronavirus. The Middle East Respiratory Syndrome-related coronavirus, or MERS-CoV, is a species of coronavirus, which infects humans, bats, and camels. So don't be kissing camels, guys. MERS-CoV was first reported in 2012. The SARS-CoV, or Severe Acute Respiratory Syndrome-related coronavirus, is another strain of coronavirus that infects humans, bats, and palm civets. The 2003 SARS outbreak killed 9% of infected patients. The coronavirus disease of 2019, or commonly known as COVID-19, is an infectious disease caused by severe acute respiratory syndrome coronavirus, or SARS-CoV-2. On December 31st, 2019, the World Health Organization, China Country Office, was informed of cases of pneumonia with unknown causes in Wuhan City, in the Hubei province of China. Common symptoms of COVID-19 include fever, cough, shortness of breath. Some less common symptoms include muscle pain, sputum production, and sore throat. There are cases that proceed to pneumonia, multi-organ failure, and death. The incubation period of the virus ranges from 2 to 14 days. There are three main paths that the disease might take. Mild disease, like a common upper respiratory tract illness. Pneumonia, which is an infection of the lower respiratory system. Most severe, a rapid progression to acute respiratory distress syndrome, or ARDS. Coronavirus can be transmitted through close human contact by respiratory droplets generated by sneezing and coughing. And that's why they're encouraging you to wash your hands, sneeze into your elbow. And because you don't use your elbow to touch anything, so it's a way to cover your droplets from going everywhere. And remember to wash your hands, and be really careful around people who don't have a really strong immune system, all right? Coronavirus facts. Why is there so much concern? COVID-19 is a highly infectious. If in an area in a densely populated like a city, can quickly spread. For the majority of people, COVID-19 is very mild. If someone has an underlying condition like diabetes or high blood pressure, lung diseases, cancer, or has a weak immune system, the situation is much more serious, and they can quickly develop complications that can be deadly. COVID-19 is much more serious for people over the age of 65. Mortality rate of COVID-19 is below 5% worldwide. However, if it spreads to 60% of the people around the world, that means millions of poor, old, and vulnerable people can die. One of the biggest challenges we're facing with the COVID-19 pandemic is the pressure it's putting on healthcare services. With many more people becoming sick and developing respiratory complication, more strain is being put on doctors, nurses, clinics, hospitals, testing facilities, and medical equipment like respirators. Sorry, guys. Coronavirus facts. Diagnosis. According to WHO, World Health Organization, the standard method of testing COVID-19 is through real-time reverse transcription polymerase chain reaction. The test can be done using respiratory samples taken by swabs from the nose or throat, or by a sputum sample. The sputum sample, that's the gunk that comes up. You know, like when they talk about hawking a loogie, it's actually, the technical name for it is called a sputum. And it's all of that mucus that comes out of your, it's actually coming from your lungs. So, let's see. Result availability can range from a few hours to 2 days. Zhonan Hospital of Wuhan University suggested other methods to diagnose COVID-19 based on clinical features and epidemiological risks. People who have had at least 2 of the following symptoms: fever, imaging like X-ray featuring pneumonia, normal or reduced white blood cell counts, reduced lymphocyte counts should be tested. The WHO released several basic preventative measures against COVID-19. Wash your hands regularly and thoroughly wash your hands with an alcohol-based hand rub, or wash them with soap and water for at least 20 seconds. By washing hands with soap and water or by using an alcohol-based hand rub, the virus that may be on your hands gets killed. Avoid touching your eyes, nose, and mouth with unwashed items or hands. Avoid close contact with people who are sick. This can be also called social distancing. Maintain at least 1 meter or 3 feet distance between yourself and anyone who is sick. Cover coughs and sneezes. Cover your mouth and nose with a tissue or use the inside of your elbow, like I stated. Wear face masks if you're sick. Wear a face mask to prevent your respiratory droplets from spreading. Clean and disinfect. Clean and disinfect frequently touched surfaces. Doorknobs, that kind of thing. Toilet handles, that would be another place you really need to be cleaning. Okay, so what I want you to do is, the very last page has a worksheet, and that's what you're going to be doing. All right. The other thing you are going to have to do, you can do this today or tomorrow, is to complete the 50-state word search. That's just for a few extra points, and it's actually also to keep you kind of entertained. Word searches are great for your brain. So give it some love and do the word search, all right? Stay healthy, and once again, like I said, this is for first, second, and fourth hour, all righty? Miss you guys.